Welcome back to UC Davis Live. This week, we're stepping away from the pandemic to talk about another public health concern, wildfire. Since 2017, we've seen what seems like a worsening series of fire seasons in Northern California, with 2020 setting a record of more than 4 million acres burned. Tens of thousands of people have had to flee their homes, in some cases more than once, and millions have been exposed to some of the worst air quality in the world. Joining us today are two UC Davis public health experts who've been studying how fires affect people, including pregnant moms and infants. Irva Hertz-Picciotto is director of the NIH-funded UC Davis Environmental Health Sciences Center and professor of public health sciences at the UC Davis School of Medicine. Following the 2017 fires in Napa and Sonoma, she established a survey to look at the effects of wildfire on people's mental and physical health. And Rebecca Schmidt is an epidemiologist and associate professor in the UC Davis Department of Public Health Sciences. She is leading the Be Safe survey on how wildfires are affecting pregnant women, new mothers, and their babies. Thanks to you both for coming on today.
Thank you for having us.
So before we get started, I just wanted to remind viewers that this is a free webcast. You can watch it live and watch it after the live broadcast on the UC Davis Facebook, Twitter, and YouTube channels. We are aware of others posting links that say that you have to pay to watch this video. Please do not click on those links. This is a free webcast. And we are taking audience questions. So if you're watching us live, just leave them in the comments section and we will work in as many as we can. So Irva, let's start with you. Your survey is called Wildfires and Health, Assessing the Toll in Northwest California, or What Now for short. What do you ask people about in it?
So our survey covers a range of aspects of the fires, how people found out about the fires, whether they evacuated or not. If they evacuated, did they stay together? How many times did they evacuate? And then we get into some of the consequences themselves, like whether their home was destroyed, whether they lost a source of income, lost a pet, lost a loved one. And then we get into health questions. First, we ask about their prior health conditions, but then what kinds of symptoms they experienced during the fires and perhaps afterwards, both physical symptoms and mental health symptoms, and then basic demographics. One respondent for each household reports about all of the members of the household and their health.
Okay, and what kinds of impacts are you seeing on people's healths in your surveys?
Well, a variety of types of things. So on the physical health side, definitely lots of respiratory impacts, asthma or asthma-like symptoms for people who really didn't have a prior asthma diagnosis, coughing, wheezing, whistling, irritated eyes actually is one of the most frequent thing that people report, itchy, irritated eyes. And many people experience these kinds of symptoms, well over half of the population.
And are these symptoms that they are experiencing just during the wildfires, or do they linger much, afterwards?
Right, yeah, and we're looking at that, but many people did say, certainly not all, some people it was really during the fires themselves in the midst of the very heavy smoke, but there are also quite a substantial fraction that do have lingering symptoms and cough going on for months. And many people reported that they seemed like they were having more colds and flu-like symptoms over that following winter after the fires. And then there's the mental health symptoms as well. And those seem to actually increase over time with many people experiencing them even 2 years out, that being a real need is for mental health help.
So what kind of mental health impacts are we talking about?
So we had a list of symptoms, and about 10, 11 symptoms, like depressive, feeling a depressive mood, stress or anxiety, difficulty sleeping, difficulty concentrating, agitated behavior, and then things like changes in their smoking or their alcohol consumption. So just a variety of both emotional and behavioral types of symptoms. Loss of appetite is another one.
So these wildfires, obviously, causing a lot of instability in people's lives. Maybe they've lost their homes. Maybe they just don't know whether they're safe or not. And that's just causing a lot of problems. And I'm assuming the mental health problems most definitely linger beyond the actual wildfires.
Yeah, that definitely appears to be the case. And the survey was completed about 4 to 10 months after the fires themselves, and then we've done a follow-up, and we haven't done the full analysis of the follow-up, but we do see even just questions about what were your household's greatest needs. We see mental health issues in the second year out as being one of the most common needs.
Rebecca, tell us about the Be Safe study. What kinds of information are you collecting from moms and infants?
Yeah, so we have the same survey as very similar to what Irva described, asking about the wildfire, their experience with the wildfires, whether they evacuated, how they were affected by those, where they went, what symptoms they had, and those kind of things. And then we also, in addition to that, ask a lot of questions about their reproductive history and their current pregnancy. And then we contacted them postnatally also to get some information on how that pregnancy ended and some questions about their baby. And then in addition to that, our focus is to get biological samples for both the mother and the baby, and also some of if the child has older siblings. And we're using those to kind of also be able to, down the road, have markers of exposure and then their biologic responses to those exposures, and also some health indicators.
So what you're actually taking like blood samples and looking for evidence of smoke inhalation or stress hormones going up, things like that?
Exactly. So we get blood, hair, urine. We also try to meet them at their delivery and collect placenta and cord blood, umbilical cord blood. And then we postnatally try to get breast milk and then baby saliva, and also fingernails and other things where we can use those to measure various things.
Interesting. So are you seeing any concerning trends?
Yeah, so we really haven't got too much of our lab data back looking at the specimens just because of COVID. A lot of the labs were shut down, but we do have some from the earlier surveys, similar to what Irva said, where we looked at, we saw a lot of respiratory symptoms being reported by mom and also the other children in the family. And similar to what she mentioned, our highest reported symptom overall for mothers was stress and anxiety. And we looked at that over time, and we saw that that was the one symptom that was reported even up to a year later at high rates. Most of the other respiratory symptoms like cough and sore throat, itchy, irritated eyes, those things tended to be high at first, but then drop off after a month or so. But the stress and anxiety lasted much longer and was reported far down the line. And we haven't done our follow-up yet to see if it's continuing. But given a lot of these moms are being impacted by current and additional wildfires, we imagine that is probably still high.
Right. And it sounds like maybe you don't have the analysis yet, but I'm wondering, are you looking at, or are you looking to find whether kind of the elevated levels of stress and anxiety in the pregnant mom are having effects on the child after the child is born?
Yeah, I mean, we plan to look at that, but we haven't gotten our results yet. We know from other studies that in general, high levels of stress during pregnancy can be associated with various health outcomes in the child. So that's one of the reasons we're looking into that. But we think that it's probably there might be some down the road effects, but we haven't looked at our data yet.
Right. So we are taking audience questions. If you're watching us live, just leave them in the comments section and we'll work in as many as we can. I guess either of you, I guess from both of you, I'd like to hear, when you both began these surveys back in 2017, did you expect that we would have year after year of severe fires in Northern California?
I think we both can say we didn't expect it to be each year topping the year prior, especially in 2017 when we started these studies. We thought, this is a time to look at this, and I know I, for one, did not think it would become an annual event, and especially with the increasing size and duration of these wildfires.
Yeah, exactly. 2017 seemed like a real landmark time where previous fires had been much smaller, less intense, less encroachment into, our built environment where our communities, residences and businesses are, mostly in the forests. And that was such a shift, I think. But I think a lot of us sort of thought, okay, well, this was really extreme, but we didn't really think that was going to get repeated in the way it has, and is getting worse each year. And other areas actually in the West, we're still having mainly just the forest fires and not these really strong impacts on populations. Like Washington State was certainly experiencing lots and lots of fires and smoke exposures going on for weeks and weeks, and but now this business of the wildland urban interface is what it's called, where we have built right up to these areas of forest or a lot of vegetation, kind of wildland, undeveloped land. And because of our climate, that where we have, we might get some rainfall, and then we have long droughts that are becoming much more intense, really due to climate change. I mean, we can't avoid saying that the wildfires are being fueled in a big way by climate change, which both increases the temperatures and creates these climatic conditions like really strong winds and very, very dry air, and that's really fueling them.
Yeah, just to add to that, we've heard a lot of new meteorologic terms in recent years. I mean, these firenadoes, and this year is the gigafire, which is something new, and it's just been kind of crazy but scary to see the increased intensity and duration of these fires, and it's the impact. Every year it gets harder to get away from it. I mean, this year is special because of COVID pandemic on top of wildfire season, but also even in the past when people were trying to evacuate, the whole western United States was covered in wildfire smoke, so it gets harder and harder to find somewhere that has clean air.
Right, and unfortunately, I mean, since we're having these fires year after year after year, the findings of your work is even that much more important, it seems. Have you been collecting more data every year from different groups, or are you just following the same group of people?
Yeah. We're when 2018 hit and we saw, the whole town of Paradise, the campfire and so forth, town being almost wiped off the face of Earth. All of a sudden it was like, oh, we had to kind of put aside the analyses of our data from 2017 and start going back into the field, learning from what we had to make sure our survey was really touching on things we left out the first time around. So, and then this year, of course, 2019 was a little bit less of an intense fire season. And so we did less that year, but then this year, I think, sort of topped it all in terms of the acreage burned. And, over our winter, when Australia was seeing these 6 million, acres or whatever, and we had been in the 100,000s being our large fires. And then this year, the same, basically within a few months, we're up to that same level. So it's becoming so overwhelming that, yes, and so if you're exposed repeatedly, the fact that it may only not be that long, but actually the fire season is getting really longer. And this year the smoke was heavy for, easily 5-6 weeks. So it's the idea that this is just a short-term exposure, it can't really do much, doesn't really apply anymore.
Right.
Yeah, and we also are continuing to enroll with 2018 Campfire, and then also with this year and 2019. And I get, even though it's devastating to see wildfire year after wildfire year, in terms of our study, it helps to get different populations and larger sample sizes into our studies, because then we can ask more questions about timing of exposure and things where different characteristics of our population, whether it differs by race or sex of the child and things like that. So we can break it down into more groups to really understand some of these associations a little bit better. So the more people that enroll, the more questions we can answer and we can do it better.
Right. And speaking of groups, I feel like all of us have been impacted by fire to some extent, right? So some people directly, others through smoke and air quality. Are you seeing differences between those two groups?
We are, yes. Some of the issues like evacuation, actually, and number of times people had to evacuate, like if they had to evacuate to one place and then the fire got close there, or for whatever reason they needed to find another place to stay because it was longer than they expected, or their house was gone and they really were multiple temporary places to lodge. That has actually an effect on the physical health, as well as the mental health symptoms. So there's I forgot what your question was.
I was just wondering about the difference between, there are the people who are directly affected by the fires,
Yes.
that, they're encroaching on their neighborhoods, destroying their homes. And then there's the far bigger population of people who are affected just by, having really poor air quality, unhealthy air quality.
Yeah.
And I'm wondering, are you, seeing differences in, how people have been impacted, differences in those?
Absolutely. Yeah. And so, for instance, one of the variables we've looked at is, was your house completely destroyed? And that seems to be just an overall risk factor. And, whether it's mental health or the physical symptoms, in fact, seem to be exacerbated by the mental health, which is strongly related to the amount of damage or the amount of losses, things like losing a family member, or death of somebody close to you, the house completely destroyed. And one of the susceptible subgroups is people with prior mental health conditions, prior psychiatric diagnoses, are at higher risk really for a whole spectrum of health outcomes.
And also prior respiratory symptoms, right?
Yeah, including the respiratory symptoms. And also we're seeing some age differences. The older ages and some of the younger children seem to have a somewhat more susceptibility around the respiratory symptoms. The mental health symptoms, very interestingly, they seem to increase with age until you get to the oldest group. And the over 65 people actually seem to be less severely affected in terms of the mental health.
Oh, that's interesting. Do you have any idea why that might be?
Well, yeah, it's a little hard to say. One thing about our survey, I will say, because it was online, partly, and just in who tends to volunteer to be in studies, is that our population is more educated and wealthier, say, than the general population, and so that might be sort of playing a part here, that who's actually taking the survey is a little bit different than who didn't, and who completed the survey and actually gave us that information. We had people who started and didn't finish, and those people were way more likely to have children in their household.
Right.
So they've got a lot of things going and just didn't have the time, say, to finish the survey. So there are some biases that we have to be aware of and not draw too much from some of the differences that we're seeing.
Irva, you mentioned people who maybe had to evacuate more than once. Do you have any idea what the effect of that is having, these crises year after year? What is there kind of a cumulative effect that people are dealing with?
We would really like to look at that. And so far, the analyses we've done have been just kind of that first year. We have the data from the second year, and we have some follow-up data from the 2017 cohort. But that's exactly one of the questions we hope to look at is for people who have been exposed to multiple fires, what kind of impacts might we see that maybe we didn't see just from their first big fire experience.
But even within one wildfire season, like I know when we looked at 2017, we had about half of the people in our study that had evacuated and half did not. And the ones that did evacuate, there were some that evacuated to up to 7 different locations. So that also is unsettling. Like there's, differences just in what they're going through in terms of having unstable housing or somewhere to stay for a long term.
Right. And unfortunately, it's not only the wildfires that we're dealing with several other kind of major crises at the same time. COVID, the economic downturn, just to name a couple, it's all happening all at once. Are you finding there's a multiplier effect on health when we're hit by these things all at once?
We haven't yet looked at it. I mean, we're collecting those exact data now, trying to look at COVID among the wildfire, survivors. And one question, actually, I mean, there could be both the sort of psychological and stress, and then you get a repeat event and it triggers all of the emotions that came with the first one. And so there's post-traumatic stress symptoms that can linger for a long time. When I started looking at the literature, I found that there are studies suggesting, and this was a study done in a Scandinavian country. It wasn't wildfires. It might have been an earthquake or flood or something. And they were seeing post-traumatic stress symptoms in people about 10 years after their experience. And it was, maybe 6 or 7% of the population. So certainly the mental health side, we would expect to see that. And also some of the one question is, are the lungs impacted in such a way that would COVID be more severe in people who have had, these recent, heavy smoke exposures or concurrent smoke exposures? And hopefully some of our data will allow us to look at that question. But that really is a question that's been raised. And there's some data from non-human primates that one of our colleagues has been following a group of rhesus macaques at the primate center at UC Davis. And there was a big smoke plume that came through Davis in 2008. These are outdoor cages where they are housed. And those monkeys had long-term effects on their immune systems and on their lung structure and lung function. So that's, these are relatives of ours, our cousins, so to speak, and probably relevant to the human situation as well.
Yeah, I was going to say it's too early in our studies. We're just collecting that data now, and we won't probably get those answers for a while. But just given the existing literature in terms of the impacts of wildfire contaminants, or in terms of air pollution in general, just particulate matter, we know that the smallest particles get deep into the lungs and they can cause inflammation all throughout the body. So it also goes through the bloodstream and impacts other tissues. So there's a lot of inflammation that results from wildfire smoke exposure. And then on top of that, we know that stress can also have impacts on inflammatory biologic responses within the body, and immune function, and other things that are really relevant to, fighting other viruses like COVID. So we haven't looked at it yet, but I would say that there's evidence that there could be these compounding effects. And then on top of that, stress also affects some of those same pathways. So, it's just a lot for the body to handle at once, and a lot of the pathways do overlap. So one might expect that there could be some compounding effects.
Right. I wanted to turn now to, some practical advice about what we might be able to do to reduce health impacts, either mental or physical or both. But let me start with a viewer question. Carla, who's watching on Twitter, is asking, do you have any tips on how to improve your indoor quality when outside air is poor?
Yeah.
Yeah, so staying indoors is recommended when the air quality is really poor, and you can look at the AQI on various websites, and most of us have gotten used to doing that here in California now more on a daily basis. But so when it's high and in the unhealthy range, you can just stay indoors and run your house fan. So if you have air conditioning, run the air conditioning with or without the air conditioning itself. And it's good to have a high MERV air filter in your air conditioning unit. And so if you can get something that's above 10, that's usually recommended to help filter the air better. Or HEPA filters can also help with some of the particulate matter, and in addition to other allergens and things. And then on top of that, there's air purifiers that tend to be a little more expensive that you can buy for in your home. And they come in various sizes, and depends on if you can afford the larger ones for larger areas, that's great. But if you can't, you can get this, and right now they're hard to come by because they're in high demand. So even getting the smaller ones and having one particular room that you can spend the most time in, and having that air purifier in that one room is recommended.
Yeah, and you can take it in. Some of these smaller units are really easy to move around, and you can just put it in your bedroom when you're sleeping, put it in your office if you're working in an office, and move it around. But
Right.
They really range in size and price, but anything is better than nothing.
Yeah.
Yeah, exactly.
And even there is evidence now that even like makeshift homemade air filtration systems, by taking an air filter and duct taping it to a box fan, does actually help clean the air. So even if that's the only alternative that you can have, that still is helpful.
Right. You just want to keep the windows closed and filter the air any way you can, basically. Okay. So what can we do, say, on a community level or a state level or a society level to reduce the health impacts, again, either mental or physical or both?
Yeah, I think that the health professions clearly have a role to play in this, but broadly, we need to develop, and this is not necessarily health systems. We need to really build up the resilience in the population, and different ways to do that. One, of course, is really paying attention to the mental health, which kind of sometimes can really spiral out of control in terms of when people get depressed and things aren't going well, and one thing after the other coming at them. And so, unfortunately, COVID has made it difficult to socialize, but being able to be with other people, talking to other people, if there's someone who lives alone, that you know of, checking in on them and really, letting them know that you're there to help, and that really makes a big difference. During the 2017 wildfires, one of the organizations that many people cited as being very helpful to them was this group called Project Hope. And they had a call line. They were getting 3,000 calls a month for basically the entire year after those wildfires. They also had kind of small group, focus group kinds of therapies sessions that they offered, and many people found those to be really, really helpful during that period, because it's a group trauma. It's not just your own individual trauma. And so on the one hand, there's reminders everywhere you would go. You would see, burned out places, and your neighbors were just as affected as you. And I think there's some sort of compounding of that group trauma, but it also offers that opportunity for people to come together to really find strength in that community of people. We need to have clean air centers that need to be available to people where they can go. Some people don't have very good air conditioning, or may not have any, and leaky. Older homes tend to be a lot more leaky in terms of the amount of smoke that gets in. So being able to go to a clean air center could really make a big difference, and especially for people who have asthma or pre-existing, respiratory conditions. I think on the broader picture is that we need to, this is going to be with us for decades, and if we want to start seeing, at least in the lifetimes of the younger people, excuse me, the younger people, change, we have to actually start doing what it takes to stop producing so much greenhouse gas emissions and get off of fossil fuels and really change the way we organize our societies and our transportation and the way we build our communities and how, the energy sources and greening everything is what we have to do, because the climate scientists have said it. This is we're on an upward trajectory for global warming, and all of the records in terms of climate that have been broken and again, most of that is the last 10 to 20 years, even though this has been building up for decades now.
Rebecca?
I would agree with all of that. And then maybe just add, we do have to think about some of those urban forest and grassland interfaces, to think about, ways to put barriers between them. So even in terms of just open space land, but also ways to reduce brush or keep, brush away from houses a bit as much as we can. And on top of that, I'm kind of always bothered a little bit by the fact that, and again, this year is a little bit special in terms of having a pandemic at the same time, but year after year, we have a shortage of N95 masks. And I think that is something that there needs to be some incentives to mass produce those and get enough where we can have them available. I mean, they are highly recommended if you do have to go outside in poor air quality to be wearing an N95 mask. The kinds we wear for COVID are not going to protect you against those smallest particles that get deepest into the lungs and cause inflammation. So I think there needs to be some sort of push to get more N95 masks available to people who need them, including people like farm workers that, they're out there all day in that air and, they need those masks, and they're just really hard to come by. And it's been, several years now. And so we figure there's a point where we know we need them. So there should be more of them available somehow.
Well, this has been really great. I want to thank you both so much for coming on today and sharing your work. It's obvious that your findings are going to be very helpful in the years ahead, because these wildfires are coming fast and furious at us, as well as all the other crises heading our way. So thank you so much for coming on.
Thank you
for having us.
Irva Hertz-Pichotto is director of the UC Davis Environmental Health Sciences Center and professor of public health sciences at the UC Davis School of Medicine. And Rebecca Schmidt is an epidemiologist and associate professor in the UC Davis Department of Public Health Sciences. On the next UC Davis Live COVID-19, we'll look into how the destruction of natural environments could lead to more viruses jumping from animals to humans. Until next time, I'm Satirius Johnson, and this is UC Davis Live.